Hey, I'm Dr. Greg with Align Wellness Center, and I've got something serious to talk with you about. But let me first introduce you to my friend. Meet Slim. He's going to help me with explaining to you a little bit about lower back pain and some of the first things you should do if you run into it. First off, let me go over some of the areas of your spine that make up the lower back. The first things you should know about in the lower back is that you've got these bones called your pelvis that you wind up resting all of your body on. Connected to your pelvis, or one of the pieces, is called your sacrum. It's a triangular bone in the lower part of your back. Stacked up on top of that are the individual segments. Each of these bones are called vertebrae, and between each of the vertebrae is a spinal disc, and intervertebral discs. These wind up providing for shock distribution, as well as they provide for a spacer for the nerves to come out of the side. In most cases, what I've found is that lower back pain occurs from misalignments within these areas, putting pressure on the nerves and causing the areas that those nerves go to overreact and trying to protect it. So whether those nerves connect to muscles in your lower back and cause them to spasm and guard, whether they go down your leg and cause you to have numbness, tingling, weakness, or just an awkward sensation down your leg, or whether they go to organs that the nerves are distributed to in your lower back. These are the main ways that we wind up noticing or knowing that we've got lower back pain. Now, I want to thank you, Slim, for helping me out and share with you that some of the first things that you should do if you ever run into lower back pain is look for someone who can manage these conservatively. Now, I'm a chiropractor, and that's what I specialize in. So we don't recommend drugs, and we don't do surgery here. We look to find the cause of the problem, wherever it may be, and then introduce natural ways to wind up correcting it, utilizing chiropractic care, massage therapy, personal training, or rehab. Now, for me, finding the cause of the problem is key, because if we don't wind up finding the cause of the problem, we may need to look at some non-natural means to take care of it, whether it's medication, surgery, or injection. We look to do everything with our patients to help them prevent that from happening, and we look to make sure to do that for anyone we meet as well. Now, I want to thank you for spending a little bit of time with me on something that's really important and serious, and I also want to let you know that you can share this with people who you may know who have gone through problems with lower back pain and may be along the process and have done any of the things that we've done. It's never too late to go back and do something conservative. Once again, I'm Dr. Greg Gerstin with Align Wellness Center, and I want to thank you for letting me be a part of your health.